hands in the tray, and the 2 hands that are in the tray belong to one person. Don't hold something for someone. Okay. What we have the palpebra here with eyelids, with the eyelashes, and the sheep has a third eyelid, basically. So do dogs. You go check out your dog when you get home. A lot of lower animals have the third eyelid. Partially, it makes lacrimal fluid. So
it. What did you say?
Makes lacrimal fluid.
Makes the third eye. Okay.
It also is protective, and it's another. I do not believe they have independent control of it. I just think it's usually on the inside, the medial aspect of the eye. So if you are lucky enough to get an eye that has all this adipose tissue and has the palpebra, and we're going to go around and we're going to cut it.
So you need some sharp scissors.
Actually, no, dull scissors are better because it prevents us from cutting ourselves really fast, and it's a really slow, dull cut then. And sometimes, one year I'm going to say that and cut myself.
Yeah.
Can you see over his head? Are you tall enough to see over his head?
So one of you will be responsible for that. You can see how the cornea is almost like a bluish color. And if you put it under pressure and then cut it, it will squirt at you. So I don't recommend you squeeze it when you cut it open. So, and if you have trauma to the eye, obviously this is not, this eye is not going to come back from its trauma. But you never want to put direct pressure on the eye because that's what will happen. So we call that the crushed grape phenomenon. So don't put direct pressure on the eye. And anything around your orbit, it's emergency. Get to the hospital because if it swells fast, and if it stays swollen for too long, it can affect your vision. So this is where, you know, you're not going to cut into yourself, you're not going to cut into your hand, and we're going to hold it down, and it's a skill because we have to hold it and not cut into our fingers and not squeeze it at the same time. So you want to be about a half an inch, and you just want to score it a little bit. And the scalpels were changed about 5 years ago, so these are pretty good. Just want to, there you go, see? That one's under pressure. So be careful. And then what we're going to do is cut around. This thing will squirt across the room.
Wow. What is the PSI inside the eyeball?
The sheep eye, I don't know.
Good question, though.
The intraocular eye pressure.
I see.
I bet if you would talk to a doctor who works with glaucoma patients, they would know.
Oh yeah, that's their business. They know right away. I asked my grandmother. She goes to an ophthalmologist because he's hot. I'm like, you're 85.
Oh my God.
She's like, oh, he's so gorgeous. Like, you going to the doctor again? He goes, yeah, I have glaucoma. I'm like, yeah. Yeah, right. Dr. Gordon's gorgeous.
I had to have a root canal done, and it helped that the doctor was attractive.
Yeah.
It always helps.
All right, so yeah, that's cool looking, right? So we open it up, and we have a little Jello shot in there, right? There you go. So we have the lens. Now the lens is opaque because it's denatured. So you know, if you in your lens, your or should be clear, yeah. And the proteins in the denature, just like when you put an egg on a frying pan, they denature, they unravel, and they become less transparent. Now, if you had eye trauma young, you're prone to having some cataract change, or you're in your sixth, seventh, or eighth decade of life, and you're outside a lot, you're on a beach, it can denature as well. Sometimes it's just dumb luck. You never tanned, and you're just 80, and you need to get your cataract taken out. Now they have choices where you can have a synthetic. You could have some countries still do cadaver. You could have ones where, and that's always risky, even though it's avascular. You can get rabies from an avascular lens transplant or corneal transplant. So, yeah, don't harvest from rabid patients, rabid cadavers. Were they foaming at the mouth? I was going to ask them. Were they really thirsty? Okay. So that is the lens, and the structure all around it are these suspensory ligaments. Remember, we call them suspensory ligaments. In parentheses was the ciliary zonules. Don't worry about zonules. These guys right here. So if the arrow is in the gel, then we're looking for vitreous humor. If the arrow is in this aqueous stuff, it's aqueous humor. Okay, that's what squirted out on me. Okay? So vitreous humor, aqueous humor. We continually make aqueous humor our whole lives. We're pretty much born with, and it's pretty consistent with how much vitreous humor we're going to have. That's why babies have big eyes. Eyes really don't change too much in size. And we're born with as much vitreous humor as we're going to hopefully die with. Now, there are some synthetics that we could put in there if we lose some of the contents inside. Also, those things that float around and they have specific shapes, protein floaters.
Sometimes it affects your vision or something.
Yeah, it could affect your vision. Mostly like when you see bright lights and you close your eyes and you can see them, right? And they track across. And some of them have like a little star, a little log, a little star with a little circle with a log. And it's like, you really can't do much about them. There's not any great treatments for it yet. Maybe they'll have laser treatment down the road. But take a look inside the sheep eye and look at this. This almost looks like a bag. This is all retina. And all this inside here, see the retina? This looks like a bag. And we're going to take that down and we'll show you the shiny mother of pearl looking structure. That's the tapetum lucidum. Tapetum lucidum. I'll put the structure's names on the board. And we're just going to ball it all up. And where it goes to is the blind spot. You can't see anything at the blind spot. It's the optic disc. And if you go like this and then, oh, it's right there. See? You go like this and then you see that is the optic nerve where it enters into the eye. And it's kind of like a balloon. You ever see those long balloons the clowns blow up? Well, that's how the optic nerve is. The vessels are on the inside, the axons are on the outside, and it comes in and it opens up and forms your nasal retina and your temporal retina, and it sees in two divisions in the same eye, and it's just glorified brain tissue basically. Even though we call it a nerve, the optic nerve, it's really just brain tissue. So when they're looking in your eyes, or someone's eyes in the emergency room, they're looking into your brain, how your brain is doing. Okay, so we would say neural tunic. You could say inner layer or inner tunic. I think we use inner on your list. So mother of pearls, tapetum lucidum. So you shine the light at a raccoon, you see that it's almost like shiny. Right, lower animals can see a hell of a lot better than we can. Deer, some jokers hunt with flashlights because you could blind them and stun them, and they'll just like stare at the light, and they'll.
Is that why deer really do stare like a deer?
Yeah, because they have a tapetum lucidum. What it does is it takes the available photons, at low light, and it recaptures them and bounces them around like a mirror, so they can see a lot better at night than we can.
And
Some
frogs too.
yeah, smaller amphibious, even reptiles have some adaptations, so they can. A lot of the nocturnal animals like raccoons and skunks can see really well at night too. That's when they're going out to eat. What else? On the inside, we can see the ridges. The ridges aren't white. Those are the ciliary processes, right? This whole dark structure, the whole thing, is the ciliary muscle. The space is the pupil, right? If you just go out the outer edge of the space, you're just lifting the rim. That's all iris, okay? Iris. This sheep has brown eyes. And then you see this white part, and there's a little ridge here. That would be the ora serrata. This is a perfect cut because you can see it very nicely. If it's not this nice, ora serrata is reserved for the model, you know. And I could ask things twice, so don't. I'm not going to ask it 3 times. That's for sure. But and this white part here is the cornea, right? It's usually translucent. So I could ask you the tunic. What tunic is that? It's fibrous, right? The whited eye on the sheep isn't really white, but it's almost like a grayish color on the outside here. That's the sclera. I reserved the muscles, the extrinsic muscles, for the models. So this is an extrinsic muscle. That's all I would need you to know. This is an extrinsic muscle. Okay. Any of this yellowish white material is adipose tissue. It's just the fat of the eye. So this would be extrinsic muscle. Extrinsic muscle. I'm not even going to ask you superior or inferior, nothing like that. Going back to the inside of the eye, and try to leave it a flap like that, so we could scoop up the lens and the vitreous humor and keep it nice and moist and together. We can separate this layer and look at the back side. Now, the tapetum lucidum is technically part of the choroid, but I like to take it out, not take it all the way out, but flip it forward and point to the back side as the choroid, because that's where all the vessels are. And it diffuses to the white of the eye. The white eye is this sclera right here, of the fibrous tunic. That's the sclera. So you got from outside, you got the sclera, then you got the choroid, tapetum lucidum of the choroid, and then you have the neural tunic, right? Of the this is the retina of the neural tunic. So that's about it for the sheep. Remember, this round thing on the outside is the optic nerve, right? On the outside, it's the optic nerve, right? And on the next station, you may have this may be elevated, right? And we point to what's right underneath it. That's the optic disc, or the may heard of it as the blind spot. Everyone has a blind spot. That's where it is. Okay. Cool beans.
Cool beans.
All right, and then don't forget about this guy: lens, suspensory ligaments, and then vitreous humor, and for pointing to a puddle, aqueous humor. So star all those structures on our list, and that's what you're responsible for the sheep dissection. Remember, not the names of the extrinsic muscles, just adipose tissue and extrinsic muscle. Okay, that's it.